And according to the California Department of Public Health, 2.2 million children will now be able to receive the COVID vaccine in the state. But we know that means families will still have questions.
Indeed. To address those concerns, we are joined now by Dr. Dean Blumberg. He is the chief of the Pediatric Infectious Diseases Division at UC Davis. Dr. Blumberg, good morning. Always a pleasure to see you. Thanks so much for being here with us.
Yeah, of course. Good morning.
Let's first of all start with this question. Talk about the side effects of these vaccines, and are they the same for both the Moderna and the Pfizer?
You know, they're very similar in this younger age group compared to older children and adults. Fever, pain, swelling at the injection site, these generally are mild and go away in a day or two. Less than 1% of children will have higher fevers. And they're pretty similar between Pfizer and Moderna. There might be slightly more side effects with Moderna.
Now, let's talk about the efficacy, because one of the vaccines only has a 40% efficacy rate. So why would you tell parents that it would still be worth it?
You know, it's very difficult to look at those effectiveness and efficacy data because they're done at different time points with different variants. The immune responses are similar or better to older children and adults. And the protection against infection may be relatively low, but that's not the most important endpoint. The most important endpoint is protection against severe disease resulting in hospitalization or death. And these vaccines appear to be very effective against preventing severe disease.
You know, Dr. Blumberg, I have to ask this question. What do you say to parents who are concerned that there haven't been perhaps long-term studies with this specific vaccine? How do you address those concerns?
You know, the longest term side effect that's ever been discovered in the 200-year history of vaccines in the Western world has occurred 5 weeks later. So we've got robust experience with these vaccines, more than 500 million doses administered in the US, more than 12 billion doses administered worldwide. We probably have more information regarding COVID vaccine side effects than any other vaccine in the history of the world.
Doctor, do you believe that a vaccine like this will be required for kids to go to school like other vaccinations are required?
You know, it might be. I think it's a little bit too early to tell. We still don't have long-term experience with COVID in terms of how it's going to settle, if it's going to be in seasonal respiratory illness like influenza is. We still don't have the finalized vaccination schedule. I anticipate that it's going to be a 3-dose primary series for all vaccines, not the 2 doses that we've been talking about, and then periodic boosters. So I think as soon as some of these issues get sorted out would be the time to consider whether it would be reasonable to require for school in the future.
Dr. Blumberg, we have about 20 seconds here. You and I have talked many times before. Are there any children that perhaps shouldn't get the vaccine?
Yeah, you know, if any child has had a previous serious reaction to any vaccine ingredient, they should not get the vaccine. Otherwise, parents should consider getting the vaccine to prevent severe disease and even death. Remember that COVID is one of the top 5 leading causes of death in this age group.
A lot of good information. Dr. Dean Blumberg, always a pleasure to see you. Thank you so much for joining us this morning and answering some of those questions and definitely dealing with the concerns of parents.
Thank you.